Hello, I'm Andres Paredes, and the purpose of this video is to share with you a neurological disorder, temporal lobe epilepsy, and how it was diagnosed in a patient, its prognosis, and its errors in communication. So to start, the patient afflicted with this syndrome is a 10-year-old boy. His mother brought him in because of a incident that occurred. Her son had been irate. He had been in an irritable mood and very antagonistic in the days prior to the incident that occurred. She attributes this to a divorce that had been occurring in the family and why he had been acting so angry. However, the night of the incident, the patient had been laser tagging, and upon returning home, he received little sleep. And upon seeing her son, he was convulsing, he was shaking, he had trembles, and he also smelt an odd odor before blacking out and collapsing. Now, when you take the symptoms that the patient is experiencing and when you compare them with common symptoms of a neurological disorder, you see that the patient is experiencing aggressiveness, the patient is angry, shaking, he's convulsing, he has that smell of odor, he's blacking out, and he's falling. And compared to epilepsy, they're very similar symptoms that are occurring. You have the hallucination of odor, you have memory gaps, those blackouts, you have collapsing, spasming, and you have sudden fear or anger, which match up with a lot of the symptoms that are occurring. You can loosely connect the sudden fear or anger in epilepsy to the aggressiveness that's occurring with the patient. However, again, that aggressiveness in the patient may be happening because he's acting out because of the divorce, but that link is there. So the team of healthcare professionals, including myself, we determined that the patient was experiencing epileptic seizures and that the diagnosis was temporal lobe epilepsy. So a common origin of many neurological disorders are some form of miscommunication or malcommunication in the nervous system, misfires in the electrical communication of our body. And in the case of epilepsy, that is the disruption of normal neuron activity. And it's attributed by multiple factors. It's caused by multiple factors. And in the case of temporal lobe epilepsy, it's that lack of sleep. It's stress, hormonal changes that are all occurring in the patient. So there is that link there. Those symptoms still match up, but that error in communication is also very similar to what's occurring in the patient. And another thing is that temporal lobe seizures also occur very commonly in teenage years, and our patient is on the brink of adolescence, so he is within that window of experiencing these epileptic seizures. And you can see in the picture here of the brain that these seizures occur in the green portion of that mannequin brain. That's the temporal lobe. And another thing, that these seizures are very short, and that may be why the mother of the patient was unable to see her son going through these convulsions and see her son collapsing, because these seizures are very short and they're very short-lived. So she may have been unable to apprehend the situation because the seizures were already finished. I want to take the time and explain this MRI image. The left side is a normal brain with normal brain function, and the right side is an epileptic brain MRI. You can see that on the right hemisphere of the brain, you have that unshaded area of red where the arrow is pointing, and that is where that seizure has occurred. And you can tell because there's a disruption, the discoloration of the brain there in the cerebrum. So to sum up the error in communication of temporal lobe epilepsy, you have overactivity of the neurons, you have constant disruption and misfiring of these neurons and of the electrical communication in the temporal lobe that can cause spasmings and these convulsions. And it's an overall jumbled mess of irregular rhythm in in action potentials and in neuron activity. So a major question that patients first ask are, am I going to be able to live my normal life? Am I going to be able to keep doing the things that I'm doing before I was diagnosed with epilepsy? And the answer is mostly yes. People with epilepsy tend to live a typical lifestyle, a normal lifestyle, but 80% of people with epilepsy are in some form of therapeutical help. This disorder is very mentally taxing. You have a lot of patients that are feeling frustrated and maybe feeling angry or scared, and it's important for patients to receive that therapeutic care in order to help their prognosis, but we'll get there. And in some rare cases, there may be learning issues, cognitive issues. That tends to happen in the younger patients, so our 10-year-old patient may be at some small risk of that. And for the prognosis and its factors that can affect prognosis, epilepsy is a very treatable disorder. It really depends on the type of epilepsy is going to influence the type of treatment. So you have a patient whose epilepsy is well controlled can once again lead that normal lifestyle, and the long-term survival rate is very high for someone with epilepsy. No one usually dies from epilepsy. It's in rare cases an issue that arose because of the epilepsy, but never directly the epilepsy itself. If treatment fails to stop the seizures, then there may be some lowered lifespan occurring. But a major thing is keeping that willpower and that sense to want to get better in the patient, and keeping the patient optimistic about getting better. It can truly make the difference in a patient making a recovery versus a patient getting worse. And in this case, this disorder can become chronic very quickly. And thankfully, in our patient, these seizures had only occurred once in the incident that we had been recording. So he had not been experiencing chronic seizures, and we were trying to do everything that we could to prevent those seizures from becoming chronic. Going back to that seeking help, whether it's mentally or physically, an epileptologist is a type of neurologist who specializes with epilepsy and with seizures, and they can greatly increase a person's prognosis in a positive way. They usually do EEG video monitoring, and most of these patients are people with poorly controlled epilepsy. You'll see these people probably have medications that have not worked with them, so they need to consult this epileptologist for more help. So yeah, these people are very critical. These healthcare professionals are very critical to the well-being of an epileptic, and that is why our 10-year-old patient was referred to one so that he could receive the help that he needed. Now, another healthcare professional is an epilepsy specialist nurse. This is the support web for an epileptic. This is where somebody can be properly informed about this neurological disorder ailing them. They can make goals. They can keep their willpower and remain optimistic. They can learn to cope with their disorder. And these healthcare professionals offer a major neurological a major mental support for someone with epilepsy and temporal lobe epilepsy, and that is why they were also referred to our 10-year-old patient. And that leads me to the final portion of this presentation, that to some, neurological disorders may seem as though your life is being ripped from you and that they're overwhelming. But if we take a step back and we learn to understand these neurological disorders, we can cope with them, and we can learn how they progress so that overall patient well-being and care is at an all-time high. And I hope that that's what you took from this presentation. So until next time, this was Temporal Lobe Epilepsy, the Grand Round, and I'm Andres Paredes. Thank you for watching.